A very good afternoon to everyone. We welcome you to Prime Health page and Prime channel on YouTube uh, with another important session, a webinar on a very important topic that we are going to discuss today is how high is too high. This is the talk of the webinar today. It will be a guide to kids fever that we are going to present to you. Uh, and our guest for the day is Dr. Geetika Dheer. Doctor, thank you very much for joining us today. Uh, just want to tell that Dr. Geetika is a specialist pediatrician currently practicing in Prime Medical Center, Ajman, and she has an extensive experience of 17 years in the field. And for the past 6 years, she's been working in UAE. So thank you very much, Doctor, for coming and giving time to us today here. Uh, Talking about the guide to kids fever, that is, as I said earlier, it's really important to understand and it's really important to know. A lot of parents are actually thinking that a fever that has come to their kids is really high. Sometimes it is not, but how do we measure it? How do we look into that? How do we know that it is really important, it is really dangerous or critical, or we should see a doctor, or how we can manage at, or should we manage at home? So these are some very important points, and the topic of the day is really important that Dr. Geetika is going to talk to us about. Doctor, without further delay, I would really like you to discuss, go ahead with the topic. As you know that kids fever, it's important to the parents to understand about the condition of the fever. But before doctor starts, I want to tell everyone that you're more than welcome to please post your questions in the comments, and Dr. Geetika will answer your questions once she has done with her initial talk. All right. Thank you very much, doctor. Please proceed. Thank you.
Thank you, Mr. Fahad, for the words, and thank you for having me on board. Yes, see, fever has certainly been on everyone's mind in the last year and a half, thanks to the COVID pandemic that we are into these days. And fever is what is fever? Now we must understand: is it our enemy? No, it's not our enemy. Fever is basically just a temporary rise in temperature in response to, it's basically a physiological mechanism, a temporary, which will temporarily raise our body's core temperature over and above our daily variation. It is a physiological mechanism to in an attempt to fight an infection, because the most common cause of fever in children are infections. Though there can be other reasons like inflammatory conditions, certain malignancies, certain drugs, certain brain conditions can also cause fever. But the good news is that it is infections that causing fevers, and most of the infections in children are viral. That's the good news. And most of these viral infections are self-limiting, they are benign, they will be or only of short duration. So the key to the parents is do not panic. Do not panic when your child has a fever. Fever can be frightening to new parents, but the fact of the matter is that having a fever is really not that big of a deal. Having a fever, by having a fever, our body is trying to fight these bacteria and viruses and get them out of our system. It makes them, their multiplication, their survival difficult, and your recovery will be faster from these infections if the child has a fever. So that's the good news. Now let's try and understand a little bit about the temperature regulation in our body. Now, how does the body create a fever? This is all regulated. It is not an unregulated or a chaotic situation. It is very much planned. Our body plans it like this. So when a virus or a bacteria enters our body, our immune system recognizes that virus or bacteria. And now it sends signal to a part in our brain that's called the hypothalamus to turn up the heat a little bit, so that these bacteria and viruses, they cannot survive in that hot and excessively hot environment, and then they can be removed from the system. So it is very much planned. And now how this will happen eventually, because you have a viral infection or a bacterial infection, or due to any other pyrogen, there will be elevation in the hypothalamus acts like a thermostat. Now there will be a release of certain cytokines, inflammatory mediators, that will set the hypothalamus at a higher set point. That means now it wants our body to maintain a temperature that is over and above our normal core temperature. Now, how it will do that? Either it will reduce the heat loss from the body, or it will send signal to make sure that the body is generating more heat. Now, how it will reduce the heat loss? By way of peripheral vasoconstriction. That means the blood vessels in the peripheries of our body, they kind of constrict to reduce the heat loss through the skin. So our body will hands and feet might look pale and might appear cold to parents. That is but natural. That is just a part of this mechanism. Second mechanism by which our body can create a fever is by increasing heat production. That is called thermogenesis. How it will do that? One of the mechanism could be shivering. So when we shiver, there is increased muscular activity and the temperature will go up. Now, once the temperature goes up, so that is these are the few clinical features. Now, when a child will start having a fever, first and foremost, he might not still have a fever. He might just have a feeling that he's feeling very cold, because our thermostat has made an arrangement that our body needs to keep a temperature at a higher level now, but he still hasn't achieved that level of fever. So he will feel cold. Now, when he will feel cold, because there is peripheral vasoconstriction, he will feel cold and he will try to take more. He will go into a warmer room. He might take a jumper or some blanket to make him warm. And by way of this, he will increase the temperature. And also by shivering, the temperature will go up. And once the effect of these pyrogens wanes away, then slowly the set point will come down. And now by way of sweating, and by these blood vessels will dilate. By vasodilatation, our skin will look hot and flushed, and it will sweat, and the temperature will normally come down. That is how the body is regulating the temperature. An exception to this is hypothermia or hyperpyrexia, which happens in heat stroke. That is a different mechanism. That is uncontrolled. That is a different thing altogether. Now, let's look at how you will know whether your child has a fever or not. By touching. Yes, some parents do present to us by saying, okay, they touch their child's forehead and they say, okay, my child is having a fever. So that's called tactile fever. That is not very accurate at gauging the child's temperature, especially infants, because infants, most of the parents come and say, I touched my baby's forehead, it feels warm. The child is otherwise well. On a routine visit also, when they will come, they will say, my child's head feels warm. I always tell them, this is normal. This is part of because the baby's brain is developing, their vasomotor system is developing, their thermoregulation system is developing. They have vasodilatation most of the times. So their increased blood supply, so they will feel a little warmer to touch. But so tactile temperature is not the best way to check temperature. More so because maybe there's a temperature difference. You might have just used a washroom, washed your hands, or you have just come out of the kitchen and you touch your child's forehead or child's body with the back of your hand. And because of the temperature difference, you might feel the baby is having a fever, but actually there's no fever. So how to check the fever? There are different thermometers available all around, which you can use, which you are most comfortable with. The key is that you should use a way of checking the temperature, that kind of thermometer which you are most comfortable with and which you can use again and again. There is no point checking temperature by one method at one time and in the evening you check with another method. That will only create more confusion. So whatever method you are available, it also depends on your child's age. Like if a child is, say, 2 months old or a newborn baby, the American Academy of Pediatrics recommends that we should be using a rectal thermometer for that. But there are another guidelines. The NICE guidelines say, okay, use axillary. So whatever you are comfortable with. I personally don't use the rectal. I have never used it. I have never recommended it to my patients because maybe most of us are not confident doing it. And there's a risk of bowel perforation, and especially in very young newborn babies, less than 3 months old babies, and especially in immunocompromised children also, you can introduce some kind of infection. So there is no, I don't recommend rectal, though even if it's the most accurate way of checking temperature. But the next two in newborn babies, in the children less than 3 years of age, but in older children, or children who are more than, say, 4 years of age or 5 years of age, who can cooperate with you in them, but still some of children, even older children, cannot cooperate. But on an average, children more than 4 or 5 years of age will cooperate, and you will be able to check the temperature by a normal digital thermometer, which you can keep under in their mouth. Now, the caveat here is the child shouldn't have had any hot or cold drink or food, because that can alter the temperature. So if the child has had anything hot or drink to eat or drink, in that case, you have to wait around 30 minutes. Another way of checking the temperature could be the tympanic, which we often use in our clinics these days, which is very, very, very quick, and it takes within 1 or 2 seconds you get the reading. But it's a little bit tricky. You have to use it correctly. Now, whatever temperature measuring instrument you are using, whatever thermometer you're using, whichever way you want to check the temperature, make sure you are confident and you read the instructions on the thermometer and you follow those instructions. Because even if you have the correct thermometer, if you're not following all the instructions, you will not get an accurate reading. So the tympanic ones, you have to, they can be used. Now these days, the tympanic ones, they are used even for newborn babies. They say there's age precision one available, which they claim that you can use even for newborn babies. But on an average, they say, okay, the tympanic ones you can use for children more than 3 months of age. Very quickly pull the ear and you snugly fit the probe of the thermometer into the child's ear. It measures the heat generated by the tympanic membrane of the child. There's also the temporal one. Now if the child has had an ear infection, if there is a wax buildup in that ear, or if the child has been laying on that ear, then don't take the temperature in that ear. Use the other ear instead, or use another method of checking the temperature. Then there is the temporal one also available, which checks the infrared heat generated by the forehead, and it's also pretty quick, and it also tells you the core temperature. Then there is the axillary temperature that you can take. Now, axillary temperature is the least accurate of all of them, but only for newborn babies you can use it. It says that it may be the most nearer to the core temperature, but for older children it's this least accurate, but it's more practical, very easy. But the little drawback here is that it has to be kept a little longer in the axilla. Child shouldn't move, and you have to keep it deep in the axilla, in the armpit, in the deepest pit of the arm. Hold the arm close to the child's chest, and then hold it for a few seconds till it beeps, and it should not be wet. Now, when you are checking a temperature, make sure you haven't had an exercise just now. Make sure you haven't been out in the hot or cold weather just now, and the child hasn't been wrapped up too much. If an infant or a toddler has been wrapped up, then soon after that, if you measure the temperature, it can appear a little higher. So you have to know which method to use and how to use and when to use. Now, these are the kind of thermometers. Sometimes what happens, if your thermometer is giving inaccurate reading or inconsistent readings, it might be that it needs a change of batteries. So make sure the batteries are new and they are working well. Then only you will get the correct readings. Okay, so now there is some reading on the thermometer. Now, what would you do with them? When would you call it a fever? Now, there has been a popular belief that temperature of 98.6 or 30 degree Fahrenheit or 37 degrees Celsius is the temperature that everybody should maintain, and anything over or below that is not good. That's not the case. Every person has a different body temperature, each one of us. So the temperature, what our body will show, will differ as per our age, will be different in different times of the day, will be different depending on the activity, depending on your hormonal levels also, depending on older girls and women. It can also be different during different parts of their menstrual cycle. So younger children have little higher temperatures. Infants have little higher temperatures compared to older children and adults. If you have been very active, especially infants who have just had a feed, who have been running around, when they come back, and small babies are just after a feed, their temperature can be higher. So if you feel that there is a temperature, but the child is otherwise looking well, check it again after a while. Unwrap the baby, keep him a little bit open for a while, and then check the temperature again. Now, at what temperature would you say fever? So as I said, it's not that only one reading, 98.6 degree Fahrenheit or 37 degrees Celsius, anything above that is not fever. There's always a range. So for practical purposes, they say core temperature above 38 degrees Celsius or 100.4 degree Fahrenheit is fever. Okay. Now, when would you be concerned about fever? You know, okay, the child's temperature is 39. Would you be concerned? Now, your concerns will also depend. When should you worry? You will also depend upon a lot of other factors like the age of the child. So, any child less than 3 months of age, any fever, slightest of fever, just 38 degree, 100.4 degree, you have to seek your doctor's opinion, because they are immunocompromised in a way. They have some bacteria that could have colonized them during the delivery, during their delivery from the mother's birth canal, that can later become pathogenic, or they will not be symptomatic. The symptoms of infection might be very, very subtle, and you might be late by the time you detect them. So the slightest of fever the child baby develops, you must seek your doctor's opinion, but be careful. If it is an overlapping or just a tactile temperature, just don't say that my child has a fever, because if you say so, then your baby will have to go through a battery of investigations, including blood, urine investigations, and most likely a lumbar puncture too, which is a test from the spinal cord. The spinal fluid is checked for infection. So you must be sure that the child has a fever. If the child is 3 to 6 months of age, temperature between 100.4 and 102 degree Fahrenheit is okay. It might be tolerated. Anything above that, you have to consult. So any temperature more than 102 degree Fahrenheit, you must see your doctor. But there's another very important thing one must understand is it's not the degree of fever. How high is too high? It's not always about degree of fever. It's not that higher the temperature, the more serious the illness is. It's not like that. There is no good correlation between the degree of fever, the severity of fever, and the severity of illness. So it might be even very high. Even simple viral infections can have rather higher temperatures. So don't be worried about the number of the thermometer on the thermometer. Be on a lookout at how your child is looking to you, how he's appearing. Is he looking ill to you? Is he feeding okay? Is he acting normally? Is he looking at you? Is he smiling? Is he eating and drinking or not? So if your child is eating and drinking well, interacting, smiling, and playing, still interested in playing around, and when that, it's but obvious for children or even adults. We all fall. When we have a temperature, we feel a little miserable. We might have aches and pains, and we might not want to be more active. We might just want to lie down. But once the temperature comes down, if the child is back to his normal self, that's kind of reassuring that there's nothing serious going on. And it will only be a matter of time. Once the immune system takes care of and makes sure fights the virus, the child will be back to his normal self. Now, more than 6 months of age, children up more than 104 degree only would be a concern, unless they have other red flag signs, including a severe headache, severe vomiting, persistent vomiting, or a pain in the neck, or pain in the eyes, or he cannot tolerate eyes, that's called light, that's called photophobia, or he has a difficulty in breathing, his color is not looking good to you, the child is looking pale or mottled or even blue in color, or the child is grunting, he's having persistent diarrhea, he's dehydrated, his eyes are sunken, his mouth is dry, he's not had a wee or a wet nappy in the last 12 hours, he's not had anything to drink for more than 8 hours now. And in that case, you must see your doctor immediately. So it's not the magic figure that they say, okay, more than 104 degree, you must go, or more than 102 degree is a concern. So it depends on the age, and it depends on how your child is looking. And so what are the different causes we already said? And these are the viral causes. Now, how would we know it could be bacterial infection? Now, some infections are mostly caused by bacteria, like a urinary tract infection. So if a child is having features suggestive of a urinary tract infection, you must see a doctor, because in that case, your child will need some antibiotics and some more investigations possibly. The indicators for urinary tract infection would be like burning in micturition, the child is peeing more than normal, or maybe peeing in the bed also, which the child never used to do before, or he has a lower abdominal pain, sometimes even blood in urine. Or it can be just an ear infection. If child has a unilateral ear pain, that's more likely to be a bacterial infection. If bilateral ear pains can be more likely to be due to a virus only. or it can be a serious infection of the brain or the layering of the brain, which is called the meninges or meningitis. The features of which we already enumerated, like severe headache, persistent vomiting, pain in the neck, pain in the eyes, and very lethargic, sometimes alteration of sensorium. He's not responding well, or he's very irritable, incessantly crying, and you cannot console the baby at all, or he has a very weak cry, and sometimes they might have seizures also. So any child who has had a seizure, you must visit a doctor. Now there are some other types of seizures also. This is called febrile seizures. Now, febrile seizures, they are incredibly common. They are seen in around 2 to 4% of all children with fevers. But here also, the good news is that they are harmless. They happen in children between 6 months to 5 years of age, sometimes even 6 years of age, when they have a fever. But you must understand, it's not the fever that's causing the infection. See, when I was in med school, whenever we used to have a child with febrile seizure, we used to send them home with telling them that the next time your child has a fever, make sure you give him round the clock antipyretic paracetamol every 4 hours or every 6 hours to make sure the child doesn't have a fever again, and so that he doesn't have a recurrence of his febrile seizure. But now we know it's not the fever that's causing the seizure. It is the inflammatory markers that are released during that infection, the same that have caused the fever, like the interleukin 1 beta, one of the inflammatory markers that excites the developing brain and results in excites the neuronal activity and can lead to a seizure. So even if you give paracetamol or antipyretic to a child, the child will have the same number of seizures as any child who did not get that kind of advice. So what you should be doing, in fact, when your child has had a febrile seizure, one thing is, do not panic. Just stay calm. Make your child lie down on a flat surface on the side so it doesn't choke, and just look at the color of the child and try and be calm and note the time of the seizure, because most of these seizures will be lasting for less than 5 minutes. There are typical febrile seizures, there are atypical febrile seizures. The typical febrile seizure will usually be of the whole body, lasting for sure less than 15 minutes, but on an average less than 5 minutes also, and it will be only one seizure per episode. So if it's this kind of episode, but if it's for the first time, you might have to visit the doctor after that, because for the first time you're not sure whether it's febrile seizure or it's another infection. We have to rule out meningitis, you must see a doctor. But a child with febrile seizure can have a recurrence. There's a 30% chance that he can have a recurrence till he outgrows it. And if his first seizure was at an age of less than 1 year, then there's a 50% chance that he will have a seizure. And if there is a positive family history of febrile seizure, more likely that he will have a repeat attack of febrile seizure. But remember, they are harmless. They will not cause any permanent brain damage. They do not cause an adverse effect on his IQ or intelligence, and only a minor increase in the risk of epilepsy. From the normal children, they have a 0.5% more chance of having epilepsy in future. But that is very negligible amount. Now, how would you manage a child with fever? Now, you know the child is having a fever. What should you do? Should you give him antibiotic? Should you give him antipyretic to bring the fever down? What should you be doing? First and foremost, remember, common things are common. He has a fever, most likely a virus, most likely an infection, and most likely a viral infection, which will be self-limiting. But as I said, a child less than 3 months of age, you have to act differently. Now, just make him lie down in a light clothing, in a comfortable, airy room, light clothes, very comfortable, maybe just a one blanket, and give him lots of fluids to drink, because fluids will help the child. If he's well hydrated, he will sweat, and that will help in dissipating the heat. So you might not need an antipyretic. Now, every fever doesn't need to be treated. A mild fever, mostly a fever between 100.4 and 102, that's called a low-grade fever, it will not cause much discomfort also. Now, when we are giving antipyretics, why should we give antipyretics? Otherwise healthy children, they don't need to be given antipyretics for low-grade fever, because it also doesn't cause much discomfort. We only give antipyretics to low-grade fever if the child is very distressed, he's having severe pain, or if he's getting dehydrated, he's not able to eat or drink anything. Only in these two situations we will give antipyretic. Or else if the child is previously unhealthy child, he has a chronic medical condition like a chronic lung disease or a chronic kidney disease or a chronic heart disease, in which case we don't want to increase his metabolism further and which he might not be able to tolerate. In that case, we make him more comfortable by giving antipyretics. Otherwise, if a child is eating well, drinking well, he's looking comfortable, he's playing, he's watching a movie maybe, and his color is looking fine, he's not dehydrated, there is no need to give any antipyretic for low-grade fevers. A fever between 102 and 104 will cause some discomfort, but only if it's too distressed, then only you give. Or if he's dehydrated, then only you give antipyretic. Fever more than 104, mostly you will give antipyretic to make them more comfortable. Now, which antipyretic would you give? Now, most commonly we are using, the first line would be acetaminophen or paracetamol. It has been around for a long, long time. It has a long track record, and it's possibly the safest medicine known. So this is something you can easily give, but make sure don't just give it. It has to be, it doesn't depend, the dose of how much you will give doesn't depend on the age of the child. It actually depends on the weight of the child. Most of the medicines in children will be as per their weight. So a 1-year-old baby might require a 100 milligram dose, or he might require a 200 milligram dose, depending on what his weight is. So we give 15 milligram per kg. We can repeat it every 4 hourly if required. But on an average, we say, okay, give it every 6 hours. But if required, we would give them every 4 hourly if the child is very distressed, or I said dehydrated, or has a pre-existing chronic condition that we need to take care of. And in case acetaminophen is not working, then the next line would be ibuprofen. Ibuprofen is also pretty safe. They say as other NSAIDs, they have a little risk of gastritis, but for acute conditions, mostly they are well tolerated. And the dose would be 10 milligram per kg. We can repeat every 6 hours if required. But make sure you don't give paracetamol and brufen together at the same time. You give paracetamol first, wait for an hour or so, because the onset of action would be at least 30 to 45 minutes. And then only if the child is still distressed after 1 hour of paracetamol, then only go for the second line medicine, which is your ibuprofen. And now, whether to give it orally, whether to give it rectally, whether to give it parenteral, intravenous, it depends. It's not that people believe that intravenous would be better or quicker. Might be a little bit quicker. What about suppositories? Some people believe suppositories are the way to go, and they will bring down the temperature faster. That's not the case. In fact, rectal absorption is more erratic. You cannot predict. It might be absorbed, it takes a little longer, in fact. So if the child is taking orally, he's not throwing up, he is responding to you, he's not too lethargic, then you can give him orally only. So oral is the first choice of giving antipyretics to children. First acetaminophen, second line is ibuprofen. And antibiotics are not. Antibiotics are not they will not act because of viral infection. Antibiotics only work against bacteria. And make sure whenever we are giving instructions about, okay, give paracetamol 5 ml, give 7 ml, which preparation? There are so many preparations available. For adults, you can say, okay, take 1 tablet or 2 tablets, Dodo 650, like that. But for children, there are different suspensions available. They are in the drops form, they are in the syrup form, they are in the double strength syrup form also. So make sure you know which antipyretic the patient has, in what strength it has, or which antipyretic you want to prescribe, in which strength, and by what they should be giving. Should they be using a teaspoon or a tablespoon? No, because on an average we say, okay, teaspoon is 5 ml or a tablespoon is 15 ml, but there are different sizes available. So the best is to use the dispenser that's available with that medicine. The drops are more concentrated. Suppose I want to give a 100 milligram dose to a child. Now a drop is 100 milligram per ml, but a syrup is 125 milligram in 5 ml. So if I have to give the child the drops, I will only need to give him 1 ml of that. But if I have to give the syrup form, the single strength, which is 120 or 125 milligram in 5 ml, I will need to give around 4 ml of that medicine. So make sure you give the clear instructions, whether they have to use the drops or the syrup or the double strength syrup. and use the dropper which is available. I'll be able to show you. So if it's like this, if it looks like this, that means it's a dropper. This is the dropper, and this is the drops available, and there will be a 1 ml dropper, this capacity of 1 ml. So you can tell, okay, this is the drops, you need to give him only 1 ml of it. And if it's the syrup, they will usually have a cap like this, if you can see. They will have a cap, and at this there will be markings 2.5 ml, 5 ml, 7.5 ml. Accordingly, you have to give. Many a times we tell our patients, okay, give Adol syrup, but we don't know whether it is the single strength or the double strength. So the pediatricians mostly are aware, okay, what color the bottle is. That will give. If it's a pink color bottle, okay, it must be the baby and infant one, which is 120 milligram. And if it is the double, if it's orange color, mostly orange and green color, it would be the double strength one. So hepatotoxicity can be a serious side effect. 15% of the parents are giving super therapeutic doses to their children because they give sometimes their tablets or half a tablet they will give what they have been using. That's not to be done. Give the correct doses in the correct amounts at the correct interval to avoid toxicity. Remember, medicines are not candies. Even if they are safe, but still they can have some side effect. Some children can have even hypersensitivity, allergic reactions, or by accident toxicity can also happen. So be very careful. Only when really, really required, administer these medicines. The key here is hydrate the child, make him rest in a comfortable room, light clothing, comfortable clothing, maybe a single layer of blanket. Sponging also can be done at times. Now the American Academy doesn't recommend if you choose to sponge your baby. Only in two situations actually we do sponging. Sponging, that means you are putting some tepid water between 29 and 32 degree on the forehead, or you can bathe the baby with that, and or in the axilla and the groins, and then let it evaporate. Now the temperature should not be too cold. It shouldn't be too hot either. If the child starts shivering, you have to stop it. As I said, if the child is having shivering, that means increased muscular activity. That will in fact increase the temperature rather than decreasing it for us. So it has to be done around 30 minutes after you start your antipyretic therapy. So first you give your antipyretic, which is the acetaminophen, and wait for half an hour, and then you start your sponging. And or the temperature is very high, more than 104, 105 degree Fahrenheit. In that case, you can start doing the sponging and give the medicine by the time the medicine will take effect, and this will also be an additional benefit to the baby. So the key is, do not panic when your child has a fever. Most likely it will be a viral infection. It will go away in 3 to 5 days. If your child's fever doesn't go away after 3 to 5 days or keeps high more than 104 degree repeatedly, then you must see your pediatrician. I'm more than happy to take any questions if you have at the end of this session.
Thank you very much, Doctor, for the wonderful and detailed information that you've given on a guide to kids' fever. I believe a lot of questions are already answered, in fact, before only. But I've got a few questions here I would really like to ask quickly. Uh, Dr. Asya is asking, how safe is suppository in children? How frequently they can be used?
See, suppositories usually recommend children more than 1 year of age. They can be given, depending one can give paracetamol suppository, ibuprofen suppository available at places. But as I said, the absorption is very erratic. It's not predictable. So you will not be able to predict how much will be absorbed. Orally, we know it will be absorbed very well. But safety is not much of an issue. Maybe the absorption will take time. So if you are giving paracetamol, you have to give it a little higher dose compared. Like suppose we are giving 15 milligram per kg as oral, they recommend giving a higher dose of 20 milligram per kg rectal. And they can be given. If really required, child is not taking anything orally, he's throwing up repeatedly, then you can give paracetamol suppository every 4 hours.
All right, thank you. Thank you so very much, Doctor. Another question here from Ms. Sunita. She's asking, why are children at lower risk of COVID-19 than adults?
See, I think the children as such are these days, because we are protecting them so much, we are not so much worried about ourselves, we are worried about our children. We want to keep them safe all the time. Parents have to go out and work. Children these days have been having online classes. They have been inbound mostly, so they are less likely to contract the infection. And those of them who are having infections, uh, are having little milder infections. That has been attributed to factors like, because they have, every child every 6 months has 3 to 4 infections, respiratory infections, and they get antibodies. And some of the, also the protection comes from the immunizations that they have had. Now they are saying possibly there's a role of BCG vaccine that the children have had, and the effect might wane off over a period of time. So they're being inbound, homebound mostly, and because of the vaccinations that they have had, they are less likely to have infection. And even if they have infection, they have milder infection compared to older adults.
Doctor, another question from Dr. Asia. Sometimes doctors give Brufen in adult. Is this safe for pediatric age group?
See, I do not recommend this practice because it only and only goes in favor of fever phobia. We don't want to create fever phobia in our patients. There is no real need to bring down the temperature really, really fast. The studies say that by giving Adol and Brufen, paracetamol and Brufen together, the temperature might come down a little bit quicker as compared to if you would give either of them alone, single agent. But do we really need to do that? What is the urgency? There is no real need. They can get there can be more confusion. There can be risk of toxicity. There can be risk of overdose. More so because they are, when the child has had a fever, he might be having a cough or a cold, and the parents would be giving some cough and cold preparation. That can also have some more of paracetamol as a part of the concoction. So there's an likelihood that the child can get overdose of these medicines. So there is no need to do that. There is no urgency to bring down the temperature. There is no need to panic. As we said, if the child has a fever, it is only helping him fight the infection. It will make him, only if the child is really distressed, you give one. In the meantime, you make him comfortable by other means. Give him, make him drink lots of fluids, make him lie comfortably, and then 30 minutes to 45 minutes, the fever will start coming down. No need to panic, and no need to, I do not recommend this practice.
Thank you, Doctor. Doctor, I've got a question here that was sent to us before the session, and the question says, what is the minimum duration of mothers, the duration mothers should be, breastfeeding the kids actually?
See, the recommendation, all mothers should breastfeed their newborn babies till about their exclusive, till about 6 months of age. Following 6 months of age, they get their formula, other complementary feeding. So till 6 months exclusive breastfeeding, up to 2 years they can continue to breastfeed their children.
All right. Thank you very much, Doctor. Another question here, Doctor, with us is, what type of fever impact children mental capabilities, Doctor?
See, as I said, do not cause a brain damage. Fevers, high fevers, they do not cause brain damage. They don't cause permanent neurological damage. Fevers don't have high risk of seizures. Only if the a brain infection or a meningeal infection, meningitis, encephalitis, only these kind of fevers might have long-term sequelae. But just that the degree of fever, we say high-grade fever or low-grade fever, it will not have any long-term complications on the intelligence or the development of the child.
All right, thank you very much, Doctor. As we are moving towards the end of the session, Doctor, I'll be asking you one more question, and then we'll proceed towards the end. Doctor, what would be the ideal contents for a children's first aid box?
Okay, so we also in our home, especially when we have kids in our home who are jumping around all the time and likely to fall around and get hurt also. So as with most of the first aid kit, it should have a band-aid, it should have some gauze pieces, some bandages, some tape to tie the bandages, and some scissors and some medicines also. It should include like paracetamol. Every household should have according to your child's age and the taste preference also. As pediatricians, we have to be sure that whatever medicine we are prescribing is palatable and as per the taste of the child. Paracetamol, Brufen, maybe an antihistamine, an antibiotic ointment, some soap and water as well, and some rehydration solution, because any illness, children are likely to be dehydrated. So have an electrolyte solution at hand also.
Great. Thank you. Thank you so very much, Doctor. Doctor, you have in fact covered all the questions mostly that we had earlier in your initial talk. So I believe a lot of questions are answered actually. Thank you. Thank you so very much for giving us such a wonderful information on a guide to kids fever. I would like to tell here that if anyone wants to, all the parents who are watching us at this time, if they are willing to see Dr. Geetika, she's currently practicing in Prime Medical Center, Ajman. You can always book an appointment on the number that is being shown at the bottom, 0470700999, or you can book an appointment through the application that we have, Prime Health Me app, on Android and iOS, and you'll be able to book an appointment as per the availability of the doctor. If you have any concerns or anything, you can always send an email to us at myprime@primehealth.ae, and we'll be responding you back. Your recommendations are really important to us. Please do give us a review on Prime Health page and on our YouTube channel, and definitely we'll be coming back to you. And of course, we will increase the quality of our work more. Thank you very much, Doctor. Once again, please do give your take-home message, Doctor, that I would really like you to give before we end the session.
Sure. So, as I said, do not fear fevers. Fevers are not our enemies. They are protective. They help us fight infections. There's no panic when a child has a fever. Don't give medicines without a doctor's advice. And only thing you can give is your paracetamol. That is only if your child is distressed. Any child less than 3 months of age, even if he looks well to you, please visit your doctor. That's a critical age. You will not be able to judge. The signs and symptoms of serious illness will be very subtle, and you will not be able to judge whether the child is, might be too late before you start intervening. So child less than 3 months of age, visit your doctor immediately at any temperature. More than that, watch your child, how the child is behaving. Child has a fever but is active and alert, smiling, eating and drinking, you can wait and watch. Viral fevers go in around 3 to 5 days. More than 5 days, you must visit your doctor.
Thank you. Thank you so very much, Doctor, once again for giving us time. I hope it was a very wonderful session and informative to all of us. And of course, for the people who will be watching it later, they'll be definitely looking forward to get all the information and will be helpful to all of us. Thank you very much once again. As Prime is all about personalized care, personally, we'll be coming back to you with another session. Till then, take care. Bye-bye.
Thank you, Fahad. Thank you.